There are two joints that are important to discuss. There is Cricothyroid Joint. It is present between the lateral surface of the lamina of the cricoid cartilage and the inferior horn of the cricoid cartilage of the thyroid cartilage. These help the thyroid cartilage of the larynx. If this is the cricoid cartilage, this is the thyroid cartilage. It helps thyroid cartilage to tilt on the top of the cricoid cartilage. And if you can see, this is the thyroid cartilage, this is the arytenoid cartilage. This tilting helps change the distance between the arytenoid cartilage and the median angle of the thyroid cartilage. In other words, it is changing the length of the vocal ligament. It is changing its length. When it is tilted forward, the distance between them increases and it becomes longer, and when it come back, becomes more vertical, the distance becomes smaller and it becomes less dense. The articular surfaces are on the medial aspect of the inferior horn and on the lateral aspect of the lamina of the cricoid joint, and the axis along with its movement, the axis will be the horizontal axis that is crossing between the two bones. It will be crossing like this from one cricoarytenoid cartilage, cricothyroid joint to the next one. And if we look at the path of the recurrent laryngeal nerve, this is a question that is asked in the examination. This nerve passes behind the cricothyroid joint before it supplies most of the muscles of the larynx. It actually supplies all of the muscles of the larynx except one muscle. So it is passing behind this joint, recurrent laryngeal nerve. The second joint that is to be discussed is between the cricoid cartilage and the arytenoid cartilage placed on the top of it. There are two surfaces, the upper surface on the lamina of the cricoid and the lower surface on the cricoid arytenoid. These two surfaces are articulating with one another. It is a synovial joint and it allows for two types of movement. One movement is that the whole of the arytenoid cartilage, it slides outside. It just slides outside. When it slides outside, the whole of the arytenoid cartilage slides outside and you see the distance increasing between them, and it leads to the opening. This opening between the vocal cords in front and arytenoid cartilages in back, this space. This space is known as glottis. So when this slide, you will see the glottis open as a V shape. You will see open as a V shape. The other thing is that the arytenoid cartilage, they remain on the top. If there is a cricoid cartilage here, tip here, the arytenoid cartilage, the one I talked about, they were sliding outside. The other possibility is that along the vertical axis, they don't slide, they rotate outside, the anterior surface going laterally and the posterior surface going medially. They rotate outwards, staying on the same point. So this is the situation. This is the rotation. This is the other movement that is possible here. When it rotates here, the glottis, it becomes diamond shape. It becomes diamond shape. So there are two possible movements of the arytenoid cartilages, and both of them are asked from you. In humans, the major, the way in which it is this one. The sliding is more important in humans, and the V-shape opening of the vocal cords, it's more